The last speaker. Is everyone excited? They did close the blinds. I was afraid everybody would be staring outside this whole presentation, hoping to be out of here, so appreciate that. I'm Todd Frucci. I'm with Pelago Health, and I'd like to spend the next 20 minutes doing some education around substance use disorder. For those of us that work at Pelago, this is a real passion of ours. And, you know, the title of the presentation today is Unmasking the Hidden Cost of Substance Use. I'm going to start the presentation today by asking people to be a little vulnerable and raise your hand if you've been impacted by substance use in your life, whether it's somebody in your family, a neighbor, a coworker. Yeah. It's kind of an interesting title to the slide because we talk about this concept of hidden cost, hidden crisis, yet it's right there in front of all of us, right? It impacts most of our lives in some form or fashion. And so today we're going to talk about, from an employer perspective, some of the statistics that may be new and interesting to everyone so that you can start to think about how this may impact your organization. I'm going to start with this 48 million number. According to the latest data, there's 48 million people in the United States over the age of 12 struggling with a substance use disorder. I'll just let that number settle in. In the states of Massachusetts, New York, Rhode Island, Connecticut, and Pennsylvania, there's a total of 45 million people that live in those states. So think about the size and the scale of the challenge that creates for healthcare and for health plans within the employer community. This is an enormous number of people that are actively struggling with this disorder. The most, which results in about 2 of every 10 people in a population struggling. So if you have 10,000 employees, 2,000 of them are likely struggling. The really interesting statistic on here is 10% or less are being actively treated. So this gets into part of that hidden concept. You know, when I have conversations with employers, with groups, I often hear, well, I'm starting to see a trend around substance use disorder, but I'm not seeing a heavy trend, or I'm not seeing a lot of people impacted. And this goes down to the fact that most people that are struggling with it aren't being actively treated. The other thing I'll point out around substance use disorder that most people, is sort of a new concept, is the fact that it is a chronic condition. So if you think about a substance use disorder, just like any other chronic condition, in an untreated state, it progressively gets worse over time. So you have this large population of people, 9 in 10 people that are struggling, that without treatment, they're progressively getting worse. In the latest Business Group on Health survey, cancer passed MSK as the highest cost spend area for most employers. What most people don't realize is how closely aligned substance use disorder is to cancer. 2 of the top 3 preventable causes of cancer are tobacco and alcohol. If you want to have a preventive way to address your cancer spend and target 40% of the people that are at one point in time going to struggle with cancer, substance use treatment is a preventive measure for that. You get people early, you get them free from substances like tobacco and alcohol, you can make a huge dent in cancer. The other thing I would say is, as a teachable moment, there's a relationship between substance use disorder being untreated and many of the other chronic conditions that you're actively trying to work on as an employer. You think about things like diabetes, you think about things like heart disease. There's a very direct relationship between untreated SUD and those conditions. And more importantly, I think there's a relationship to people in those condition states that are the highest spenders. You know, I'll have conversations with customers, prospects, around things like diabetes, around things like MSK or heart disease, And the conversation often goes, I've got this group of people in those categories, the very highest spenders in those categories, that I'm just unable to engage. I can't get their diabetes in check. I can't get their heart disease in check. What you'll often find is there's an underlying condition of substance use disorder attached to that as a secondary condition. And if you don't solve for substance use disorder, if somebody's struggling with alcoholism and is also a diabetic, it's very, very unlikely that diabetes will ever be in check until you solve for that underlying condition of substance use disorder. In most cases, if there's a comorbidity between substance use disorder and these other conditions, the spend pattern for that individual will double and it will chronically get worse. Again, this is a chronic condition in an untreated state will progressively get worse over time. Why is this? Why is it that 9 in 10 individuals that struggle with a substance use disorder are being in an untreated state? We do surveys, there's lots of surveys out there. You'll hear words like stigma, you'll hear words like access. This is a survey we did, and we asked the question of, is substance use treatment an important program for your employer to offer? And 56% of employees said that their employer supporting substance use is a critical kind of benefit to offer. Yet only 14% reported having access. So why is this interesting? I'm gonna ask everyone to raise hands again. Who here in this group offers substance use support for their employees? Either through an EAP, the health plan, pretty much everyone, right? Everyone has some level of substance use treatment available to their employees, yet when you ask the employees, only 14% of them believe that they have it. You know, a huge disconnect, right? And we can talk about why that disconnect exists, but there's a huge disconnect between what employees have access to, what they feel comfortable engaging in, and you know, where their mind is. A little bit more around this study. You can see here, we asked this concept of stigma. Are you comfortable speaking around various topics? From having an accident at work to losing your job. And what you'll see here is when you start to get into these categories around, am I drinking too much? Do I have a problem with a substance? The stigma is just off the charts. This is a really critical concept if you're an employer and you're trying to understand how to get more people engaged. You have to get past the stigma. You have to create a safe environment for employees to raise their hand and ask for help. There's a lot of time spent on communications. There's all kinds of studies that are out there that relate to the mental state of an individual with substance use and how you have to take them through the stages of change to get them to the point to raise their hand. You have to take them from, I don't have a problem, to I may have a problem that I'd like to learn more about, to I'm now confident that I have a problem that I need addressed, but I'm not comfortable asking for help, to I'm now comfortable asking for help. You have to take them through those stages of change. And this is why that core 9 in 10 concept, it's a lot of the 9 in 10, right? Why are 9 in 10 people not asking for help or receiving help? Most organizations don't understand this concept of stages of change. They don't communicate the programs in a way that reduces this stigma. And so employees just don't feel safe and secure at educating or raising their hand for help. This concept of stigma is very, very important. You'll see things like recovery-ready workforce concepts out there. You'll see all kinds of different programs that employers are using to really move people to a level of comfort around, I can raise my hand, ask for help, and I won't be punished. Let's talk about some concepts around how do you know if you have a gap in substance use treatment in the benefit structure that you're providing. And And I'm going to go through some of these concepts. I wish the crowd wasn't so big because I would love to allow everyone to ask questions. But, are people that are on the lower acuity spectrum of substance use asking for help? What does that mean? Just like any other chronic condition, there's a spectrum of acuity related to substance use disorder. There are people very early in that journey with that disease state who may be drinking more heavily than they need to, all the way through. There are people where alcohol has taken over their life and done a tremendous amount of damage and they need high acuity care. Are people in the early stages of that disease state asking for help? That's a huge sort of trigger point if you know you have a program that's being effective. If all of you're seeing in your claims and in your interactions with this concept is very high acuity people raising their hand that need to do things like go to 30-day inpatient rehab, what you know is you're not capturing these people early, right? Those folks at that very high end of the spectrum typically have hit the point in their life where it's unmanageable and they have to ask for help. Getting to people early, getting to those lower acuity levels is a really critical concept that's important to understand. What are your treatment and pharmacy costs? Do you have a way to look at not only people that are actively engaged in treatment, but look for people that are at risk? There's all kinds of ways to look at healthcare data, healthcare claims data, and pharmacy claims data, and find people that are likely actively suffering with a substance use disorder, but aren't actively being treated for it. There's claims patterns you can look at. There's density of claims around certain conditions that you can look at. So there's a lot of sort of reporting and analysis that you can do specific to claims costs to really help you identify those 9 in 10 that may be suffering in silence. Are you seeing increased costs on some of these secondary conditions like diabetes, hypertension, heart disease, and maybe more importantly, are you seeing a subgroup within each of those categories that are very, very high spenders that you're just unable to engage? When you look at their claims patterns, you can see those disease states are just progressively getting worse, and they're not engaging in programs you may have in place for those disease states. Are they not engaging yet they are a perfect candidate to engage in a diabetes program, an MSK program, things like that? That's a really big one. If you look at those high cost claimants, there's some patterns that you can see in there that are really sort of earmarks for people that are struggling with a substance use disorder. Do employees feel comfortable asking for help? Is anyone engaging in those early stages of acuity? Are people forming groups around substance use disorder, employee resource groups, things like that? Is the culture in general a recovery-friendly culture? Or do employees feel like there's penalties around raising their hand and asking for help? How do you handle things like second chance agreements? If an employee happens to be under the influence at work and they're put into a second chance program, what do those programs look like? Are they punitive, or are they really meant to help that employee through that moment in their life that they're struggling, get them better? We know that there's all kinds of positive results from getting somebody into recovery. They turn over half as much, they miss 14 less days of work, they spend $16,000 a year less on the healthcare. If you can get somebody to engage in a program around substance use treatment, there's all kinds of benefits for themselves and their families and you as the employer. And then the last thing is just, are we communicating? Are we talking about this? Is this a subject that people feel comfortable having a conversation around? So a little bit about Pelago. We are a 50-state virtual substance use treatment program. We have technology as part of our solution, but the technology is ultimately an enabler for the clinical care we deliver. Our core value is we deliver substance use treatment through virtual telemedicine model, and we deliver it through a clinical care team that are employed by Pelago. So licensed drug and alcohol counselors, coaches, physicians, and pharmacists across all 50 states who are employed by us deliver evidence-based specialized SUD treatment. We're very proud of our clinical outcomes. You can find those on our website, or I can share them with you. Anyone that's interested, we have 14 peer-reviewed studies that are available that really document that our ability to treat somebody through a telemedicine model for substance use, those outcomes overachieve outcomes that traditional care in an in-person setting deliver. We're polysubstance, so we deliver tobacco, alcohol, opioid, and cannabis, and we're launching stimulants. Why is this important? Because many people that struggle with a substance use disorder struggle with multiple substance use disorders, and you need to be able to treat more than one at the same time to really get most people into recovery. I talked earlier about the idea that it's clinically delivered model. We do cover all severities, so we cover people that are very early and low acuity all the way through those very high acuity settings. 90% of the people that engage with Pelago, we treat them through our model. About 10% that are very high acuity that need things like detox or inpatient care, we navigate them to great quality choices within network. And then maybe most importantly, we follow their treatment while they're there. And when they discharge from those 30-day settings, we bring them into our program, wrap our counseling and coaching around them so that they can get into long-term recovery. 50% of people that come out of rehab go back to rehab. You know, why is that? Because they don't have the support they need when they come out. And then I mentioned earlier, but this is for adults, teens, 15 plus, and families. Adolescent, there's 11.5 million people in the United States between 12 and 25 that have a substance use disorder. If you think finding adult substance use disorder treatment is challenging, try to find teen substance use disorder treatment, a specialized treatment. So we do cover adults, teens 15 and up, and then families. You know, I ask everybody if you were impacted by substance use disorder. Everybody in the room basically raised their hand. What I didn't ask is who here has had a substance use disorder, right? What I'm guessing is a lot of the folks in this room, it's the impact side. And so our ability to help a family understand how to engage with somebody they love and help them get into treatment is a really critical component of what we do. I think I covered everything there. So the last thing, and I've got a minute left, I think, which is about perfect. You know, you've got 48 million people struggling. You've got most of those people not being treated. One of the beautiful things about what we're talking about today is if you can get somebody into treatment, if you can help them move through those stages of change, the stories that are created from that are just life-changing, right? We have a weekly call within our organization where we bring these stories to life, and we talk to the entire organization about the good that's been done the week before. We treated over 10,000 people last year for substance use disorder and changed a lot of lives. And I want to end with this video that really kind of brings to life what a before and after picture looks like around substance use treatment.
One of the main reasons why I decided to seek help was because my daughter, she had made the comment that she wishes that she can get me all the beer in the world so that way I can be happy.
Well, opioid use started with just taking pills, overtaking pills, and then it became an issue where I was shooting heroin.
Once I noticed dishes piling up, cat litter not necessarily getting changed, laundry getting worn more than once, I realized I had a problem.
I was tired of the lying, the stealing, the cheating, the broken relationship, just the everyday struggle that I was going through. And I just finally gave in and said, I'm ready. Let's do this.
And for my daughter to believe that alcohol brings me more happiness than she does, absolutely tore me apart. And hearing that from her made me realize that I needed to be a responsible parent and change for my daughter.
I no longer have to lie to people, hide things from people.
That my goals are to leave this history behind me.
My marriage is better. My health is better. I feel more energy.
I no longer look forward to getting up and getting drunk every morning. And I feel like I'm in control of everything and feel like the world is my limit at this point. It's honestly completely changed my life, and I'm very thankful for the help.
Like I want to just take that step on becoming normal again. With Pelago, I feel like I have crossed that bridge.
I'm really, really proud of myself now.
Thank you all. Happy to answer any questions. I don't know if we have questions maybe afterwards, but really appreciate the time today.